Hi, my name is Max, and today I'm having surgery at Parkview Regional Medical Center. Come with me, and I'll show you what to expect. I'm feeling a little nervous this morning. My grown-up told me that is totally normal. I brought my favorite blanket and stuffed animal. I also packed a bag with my favorite things to play with while I wait. When I arrive at entrance 2A, I check in at the desk. The receptionist gives my grown-up a bracelet to wear. This bracelet has my name on it and will keep us connected while we're here today. I wait in the waiting room until it's my turn. I can choose to read a book or play with something from my bag while I wait. When it's my turn, the nurse calls my name. My grown-up will come with me. The doctors and nurses need to know more about my body. I stand against the wall so the nurse knows how tall I am. There's an arm that moves down to gently touch my head. I stand on a scale so the nurse knows how much I weigh. My job is to stay still. Next, the nurse uses a thermometer that moves across my forehead and in front of my ear to measure how warm the inside of my body is. Now I'm ready to go to my pre-op room to finish getting ready for surgery. My grown-up will come with me. The nurse gives me a bracelet to wear that matches my grown-ups. Next, the nurse uses a blood pressure cuff to check how blood is moving through my body. It feels like a big hug around my arm. My job is to hold still. Now the nurse checks how much oxygen is in my blood using a pulse oximeter. The pulse oximeter is a sticker or a clip with a red light. It gently sits on my finger. Now the nurse uses a special tool called a stethoscope to listen to my heart and lungs. It may feel a little cold when it touches my skin. I change into special pajamas called a gown. This will keep germs from my clothes out of the surgery room. My grown-up will keep my clothes with them while I am in surgery. During my visit here, I meet doctors and nurses who ask questions to get to know me better. My job is to ask any questions that I have for the doctors and nurses. One of the special doctors I meet is called an anesthesiologist. This doctor's job is to give me sleepy air through a mask to help me fall asleep before surgery. They will give me the exact amount for my age, height, and weight so I stay asleep during the whole surgery and wake up after. Most kids dream during this time, so you'll have to tell your grown-up what you dreamed about. When it's my turn to go to the surgery room, I can give hugs, kisses, or high fives to my grown-up. They will wait for me in a special room just for family. I bring my special blanket and stuffed animal to help me feel comfortable. In the surgery room, I see doctors and nurses wearing blue hats, shoe covers, and an outfit that looks like pajamas to keep extra germs out of the room. There are big lights like I'd seen at the dentist, and computers like I'd seen at school. The surgery room nurse helps me move to a tall bed that's next to a green balloon. The room feels a little cold, but a nurse brought me a warm blanket. I see and remember the doctor that will give me the sleepy air soon. Special stickers are put on my chest to watch my heart while I'm asleep. These feel sticky and cold. The blood pressure cuff goes back on my arm, but it won't give my arm a hug until I'm asleep. The pulse oximeter will also be put back onto my finger. All of this helps the doctors watch my body while I'm sleeping. When everybody is ready, I breathe sleepy air through the special mask that covers my nose and mouth. The green balloon grows as I take big breaths. The doctor will talk to my grown-up in a consult room when my surgery is all done. Then my grown-up will keep waiting for me to wake up in the special room just for family. I wake up in the PACU or wake-up room. My job is to tell the nurse how I'm feeling. I see a tiny straw with a clear bandage on my hand called an IV. This helps my body get medicine quickly if I need it. My grown-up is able to come back to the wake-up room now that I'm feeling more awake. I can choose to drink some water or eat a popsicle if I'm feeling up to it. The nurse says I'm ready to go home now that I'm able to eat and drink. I still feel a little sleepy, but that's normal. I don't need my medicine straw anymore. The nurse takes off a clear bandage, slides out the tiny straw, and puts a new Band-Aid on. My job is to keep my hands still. I get to ride in a wheelchair to the door. My grown-up drives the car up to the door so I don't have to walk far. Thank you for joining me at the hospital today. Now my job is to get a lot of rest at home.